In 1997, I was diagnosed with ulcerative colitis, and I'll never forget the doctor coming in saying, after a scope, you have ulcerative colitis. And then he walked out of the room and came back 45 minutes later, and that whole 45 minutes I'm like, ulcerative colitis, what's that? Am I going to die? What the heck is it? Basically an inflamed colon, and not fun by any stretch, and that was 1997, and so I just had a really difficult time getting it under control, and shortly after my diagnosis, doctors in Grand Forks at Ultra Clinic said, you need to be at Mayo. Came down here, and they put me on the right kind of medication that got it really under control, so it became kind of a problem 4 or 5 times a year with a flare-up. It really helped a lot in getting under control. Off and on over the last 10 plus years, I've had to come back and try to recalibrate a little bit, and it's gotten to be the last couple of years where it's been more and more difficult with medication to get it under control. So I've since moved to Fargo, and the doctors there have said, you need to go to Mayo. And so I came down here last summer, brought a number of test results from Fargo, including colonoscopies, and the doctors at Mayo spotted some things that they didn't spot at home, which included some precancerous cells in the colon, and did some follow-on tests here and said, yep, more random samples, more precancerous cells, so it'd be reasonable to have your colon out, because at some point this is going to become cancer. So I'm ready, willing, and able to get the colon out, and quite actually relieved, because it's consumed a big part of my life, and it's difficult. Ulcerative colitis is kind of one of those lifestyle issues that just is really tough. When you flare up, especially, you get almost like arthritis conditions, and you're tired and you're worn out, and you go to the bathroom a lot more frequently than you do normally, and it just becomes kind of deal where you never go anywhere without first looking where the bathroom is, and it starts to just kind of control your life, and that coupled with a 10 times greater risk of a colon cancer after you've had it 10 years means having it gone is a relief. So I'm looking forward to that. When it first became obvious that at least it was time to consider having the colon out, given how difficult that was, I met with a surgeon at what is now Sanford Health in Fargo, and I also had gastric bypass surgery. And I was 4 or 5 years ago, and the doctor that I met with had never done a surgery to remove a colon on anybody that had gastric bypass, and ultimately talked to my primary care doctor, completely agreed, said no, it's not a surgery, given the fact that we just don't see a lot of folks that have their colon out that have had gastric bypass, because a lot of the plumbing's in the same neighborhood. So obviously, and I really found that out very early in my conversation with Dr. Pemberton here. I was amazed. He wouldn't schedule this surgery until the schedules matched with gastric bypass surgeons, who he also wanted consults with and in the room. Part of the after effect of gastric bypass surgery is you have way more skin than you need, and that makes this particular surgery more difficult for the placement of the bag. And so I had to have some plastic surgery as a precursor to this surgery, and he wanted the plastic surgeons involved to say, where's your incision, where's mine going to be? And I was, as usual, blown away by the level of care at Mayo Clinic and the attention to detail. It's just a great comfort more than anything. I mean, I talk to people all the time because I'm a Midwesterner, and when you're in the Midwest and live, within an hour or two, or a few hours drive of the best medical care on the planet, why wouldn't you come to Mayo? And whether that's for an annual checkup, on the executive program, or whether that's for some important care, it's just such a great peace of mind thing to leave here knowing that whether you're dealing with a particular challenge, the best are dealing with it, or whether or not they've looked and didn't find anything, how can you get any better than that, to have the best in the world look and find and probe, and it's a great comfort to be here. And it was again a reminder in my conversations with the surgeon for this particular surgery to know that every base was being covered, and just things you wouldn't think of or you wouldn't normally get in good quality health care that are in many other places, but just that next level that really is a great comfort for me as a patient.